All right, the outside of the heart, we have several different features that we can look at. The apex of the heart is where it comes to this little point down here. The auricles are called dog ears, and that's this little thing like this that looks like a dog ear, and this little thing like this that looks like a dog ear. So this would be the right, this would be the left, because this is the patient's heart. The base of the heart is where the major vessels come out, so that's the top, forming the base of our triangle and the apex of our triangle down here. The interventricular groove is this groove that runs down, it's a ditch that runs down the front of the heart, and there is a posterior interventricular groove that does this. Everything else is pretty much going to be on the inside of the heart that's not a vessel. So I'm going to take this off. I'm going to take this off, and I'm going to take this off so that we can now see inside the heart. So starting at the top, the aortic semilunar valve would be in the aorta, so it would be this one right here, aortic semilunar valve. The right and left atrium, right atrium, left atrium. The bicuspid valve is the big one that's in the left side of the heart. The way I know it's the left side is it's much thicker over here, it's much thinner over here. So the left side is the high pressure side. This is the bicuspid valve here. The chordae tendineae, these are all of these kind of stuff like this. Remember the trabeculae of spongy bone? That looks kind of like that, so that is the trabeculae carne, and it looks like carne asada to me, which sounds good right now. Endocardium. The part of the heart that the blood is actually touching is this lighter pink color right here. This is the endocardium. The myocardium is the muscle, so this is myocardium. This is all endocardium. And epicardium is this outer side, so denoted by the little yellower color right here as it goes around. Inner atrial septa is the septa between my two fingers here that separate the two atria. Interventricular septa between the two ventricles. We did the myocardium, the papillary muscle. These are the muscles that the chordae tendineae attach to. So I would like for that one to be right there. Here's a good papillary muscle where these strings, the chordae tendineae, are attached. Pulmonary semilunar valve. In the pulmonary trunk, there is a semilunar valve right here. Trabeculae carne we did. Tricuspid valve is this one, which is in the right ventricle, between the right atrium and the right ventricle. And the right and left ventricle. Right ventricle, left ventricle. Stop.